Get ready because 2025 is shaping up to be a year of massive change in Medicare and Medicaid, and most people have no idea what's coming. We're talking about changes that could directly impact your family's budget and your ability to get medical care. So forget what you think you know, because we're about to break down what's really happening with Medicare and Medicaid, and what you're going to learn in the next few minutes could save you thousands and protect your access to care. Now, you've heard the words Medicare and Medicaid your whole life. They sound like these big, unchanging safety nets. Well, for some, they're a promise to our seniors, and for others, they're a lifeline for low-income families, kids, and people with disabilities. But under the surface, a major shift is happening. We're staring down at one of the biggest healthcare changes in a generation, and it's a story of two things happening at the same time. On one side, we have new laws kicking in that will bring huge relief to seniors struggling with prescription drug costs. And on the other hand, there are some enormous budget cuts being debated in Washington that could shake the very foundation of the system that nearly a quarter of the country relies on. So this isn't just politics, it's about your coverage. It's about knowing the rules and the numbers that decide who gets care and how much it's going to cost. We're not here to scare you, we're just simply giving you facts based on official government sources and nonpartisan analysis about the laws already on the books and the proposals being fought over right now. Because in this new environment, what you don't know can absolutely hurt you, and it could mean losing coverage that you thought you had or facing a medical bill you never expected. So let's pull back the curtain on the biggest healthcare changes of 2025. To really understand what's at stake, we have to start with the biggest debate on the table, a potential top to bottom change to Medicare. In case you're not familiar, Medicaid is the governmental program that helps millions of Americans that are low income adults, kids, pregnant women, seniors, and people with disabilities. The debate starts with a number that's hard to even wrap your head around. A proposed cut of over $1 trillion from Medicaid and CHIP, the Children's Health Insurance Program, over the next 10 years. Now in the news, you'll hear vague terms for this like financing reforms or structural changes. Let's be real about what that means. A cut that big isn't just a little trim. It would be a total rewrite of the 60-year-old promise of the program. So how would it work? The main idea being floated is something called a per capita cap. It sounds boring, but the effect would be huge. For its whole history, Medicaid has been a partnership. The federal government matches a chunk of whatever a state spends. If a state has a health crisis like a natural disaster and its costs spike, federal money goes up too. It's an open-ended promise. A per capita cap would end that. Instead of matching what's needed, the federal government would give each state a fixed dollar amount for each person on Medicaid. If a state's healthcare cost goes over that amount, too bad. The state is on its own at that point. When states get hit with a budget crisis, maybe a new expensive drug hits the market, they're left with only a few terrible options. They can kick people off the program entirely, they can cut the benefits they offer, or they can slash payments to doctors and hospitals, which could cause those providers to stop taking Medicaid patients altogether. At the same time, there are proposals to change how Medicaid expansion is actually funded. The Affordable Care Act, or ACA, lets states expand Medicaid to cover more low-income working adults, with the federal government picking up 90% of the tab. As of 2025, 40 states and Washington, D.C. have done this, covering millions of people. Now, new proposals aim to get rid of the financial incentives for other states to expand and even cut the funding for states that already have. This would put massive pressure on state budgets, forcing them to either pay a lot or roll back coverage for people who have had it for years. It's a multi-part strategy with one main goal: spend less federal money on Medicaid. The nonpartisan Congressional Budget Office estimated that if these proposals passed, millions of people could lose their health insurance. One projection even suggested over 10 million people could be dropped from Medicaid and CHIP by 2034. Now again, this isn't happening tomorrow. This is just the documented, calculated outcome off of the proposals on the table. Now, what do these proposals actually mean to you? $1 trillion cut can feel like just a fantasy number. It's hard to picture what it even means. So let's break it down to your town, your family, and your life. This is about the real world impact on people who are often in the toughest spots. Now, no nowhere would these kind of cuts hit harder than in rural America. That's not an opinion, it's just a fact of life and economics. In rural areas, Medicaid isn't just some program, it's a pillar of the whole town. A bigger percentage of both kids and adults in rural towns rely on Medicaid and CHIP, and for many of these communities, the local hospital is the main place to get care, also one of the biggest employers. The financial health of these hospitals is tied directly to Medicaid. So when you talk about cutting billions from Medicaid, you're really talking about pulling the rug out from under thousands of rural hospitals that are already barely hanging on. Even before these proposals, the situation was pretty grim. Data from the American Hospital Association and UNC's SHEPS Center show a steady trend of hospital closures, especially in rural areas. As of early 2025, hundreds of rural hospitals were already considered vulnerable to closure, with nearly half of them losing money. Now imagine dropping a massive federal funding cut on top of the fragile system. It could be catastrophic. Forcing states to pick up more of the bill would almost certainly lead them to pay hospitals even less, pushing more of them over the edge. This creates what people call care deserts. It means the local ER isn't there anymore. It means the place where babies are born shuts down. It means if you have a heart attack or a bad car wreck, the nearest hospital might be an hour away. And when a hospital closes, it doesn't just affect Medicaid patients, it affects everyone. People with Medicare, private insurance, everyone, because the whole healthcare system in the area just collapses. Number 2 is seniors. There's a dangerous myth that it's just a Medicaid issue and that seniors on Medicare are totally safe. That couldn't be more wrong. In fact, low-income seniors are incredibly vulnerable to Medicaid cuts, especially the ones who are dually eligible. That means that they use Medicare for their main health insurance, but they rely on Medicaid to pay for all the things that Medicare doesn't cover. Think about it. Medicare has a monthly premium and deductibles that can be crushing if you're on a fixed income. The standard Part B premium for 2025 is $185 a month. The hospital deductible is $1,676 every time you're admitted for a new issue. And for low-income seniors, Medicaid is what makes Medicare affordable by covering those costs. For them, losing Medicaid would literally mean that their Social Security check suddenly shrinks by hundreds of dollars. But the biggest, most devastating hit for seniors would be to long-term care. This is a fact every family needs to hear. Medicare does not pay for long-term nursing home care. It's Medicaid that pays for the majority of long-term care in the United States. It's the safety net that millions of middle-class families have to turn to after a lifetime of savings gets wiped out by the insane cost of nursing home care. So big cuts to Medicaid threaten this whole system. When states are forced to tighten their budgets, they might have to cut out optional benefits. And while nursing home coverage is mandatory, the services that let seniors stay in their homes, called home and community-based services, are mostly optional for states to offer. This creates a twisted incentive. A state under pressure might cut the very home health services that keep seniors independent, forcing more people into more expensive nursing homes. Another huge part of the proposed changes is requiring people to work to get Medicaid. On the surface, it's pitched as a common sense way to encourage people to be self-sufficient, but the general idea would require able-bodied adults to work, volunteer, or do other activities for at least 80 hours a month to keep their health coverage. But the reality of a system like this is way more complicated, and critics even say it's just punishing. First off, most Medicaid recipients who can work are already working. Many are in low-wage jobs with hours that are all over the place. They might work 100 hours one month and 70 the next, not because they're lazy, but because that's the reality of their job. On top of that, creating exemptions for people who are sick or taking care of kids or have a disability creates a whole new mountain of red tape. The person has to prove they qualify for an exception, which can almost be impossible if you don't have good internet, transportation, or have a disability. We don't have to guess how this would turn out. We saw a real-world test in Arkansas when they tried it, and it was a disaster. Over 18,000 people lost their health coverage in just a few months. And the kicker, a study found that the policy didn't even lead to more people getting jobs. It just created paperwork that tripped people up and caused them to lose health care. People lost coverage not because they wouldn't work, but because they couldn't deal with the administrative hurdles. The proposals being debated would take this idea national. The Congressional Budget Office has said that these work requirements would save money mostly because they would cause millions of people to lose their health insurance. It's a path to uninsurance, not a path to a job. Finally, let's talk about one of the most personal parts of these proposals, the threat to home and community-based services, or HCBS for short. Like we said, these are the Medicaid services that let seniors and people with disabilities get care in their own homes instead of an institution. It could be help with bathing and dressing, nursing care, or meal delivery. For tons of families, HCBS is what allows a grandparent to age with dignity at home. It's what lets a young adult with a disability live on their own. People overwhelmingly prefer it, and it's often cheaper than a nursing home. But because these services are mostly optional for states, they usually are the first thing on the chopping block when money gets tight. The danger is pretty clear. As states get squeezed, they'll have to make impossible choices. And history shows that they're likely to respond by putting caps on HCBS services, creating long waiting lists, or cutting services entirely. This would leave families in a terrible spot. Either quit your job to provide 24/7 care yourself, or put your loved one in a nursing home that they don't want to be in. It's a devastating loss of independence and dignity. All right, enough talk about all the bad things with Medicaid. It's easy to feel hopeless, but 2025 isn't just a story of potential cuts. For millions of Americans on Medicare, the year is actually bringing some of the best healthcare news in decades. This is the other side of the 2025 changes. A wave of relief that will put real money back in seniors' pockets. The single biggest piece of good news comes from the Inflation Reduction Act, a law passed back in 2022. Its most powerful parts have finally kicked in on January 1st of 2025, and they're aimed right at the high cost of prescription drugs and Medicare Part D. For years, seniors with high drug costs for things like cancer or MS could face bills of $5,000, $10,000, or even $15,000 a year. In 2025, that is all over. The law created a hard cap on medications. From January 1st, 2025, no one on Medicare will have to pay more than $2,000 a year for their covered prescriptions. Now let me say that again because it's huge. Your total out-of-pocket cost for your medicine is capped at $2,000 for the whole year. Once you hit that cap, you pay $0 for your covered medications for the rest of the year. So for example, someone taking a cancer drug that cost $100,000 a year could have paid nearly $12,000 out of pocket back in 2023. But now in 2025, their cost for that same drug will just be $2,000. And that's not all. The donut hole of Medicare is gone as well. The old complicated system is being replaced with a much simpler one. Second, the Extra Help program, which helps low-income folks with drug costs, has been expanded, making more people eligible for plans with $0 premiums and very low copays. This is all on top of changes that are already here, like the $35 monthly cap on insulin and free vaccines like the shingle shot. Now, while the drug cost news is great, you still need to know the standard cost for Medicare in 2025 as they've gone up a little bit. So here's a quick checklist for your budget. Part A, which is hospital insurance, most people pay no monthly premium for. The important number is the hospital deductible. If you're admitted, you'll have to pay this for each benefit period. In 2025, that deductible is $1,676. Part B, which is your medical insurance, this covers doctor visits and outpatient care. And for 2025, the standard monthly premium is $185 a month, up about $10 from last year. The annual deductible for Part B also went up a tiny bit and is at $257 this year in 2025. After you pay that, you usually pay 20% of the cost for most services. So while premiums are up slightly, for most people, the huge savings on prescription drugs from the new $2,000 cap will more than make up for it. So the big question is, how do you get ready for the potential chaos in Medicaid? Unlike the clear-cut changes in Medicare, the impact of the proposed Medicaid cuts would depend entirely on how your states react. But sitting back and doing nothing about it is not a good plan. Here's what you and your family can do right now to set yourself up for success. Step 1 is get your house in order. First things first, make sure all your info is 100% up to date with your state's Medicaid agency. Don't assume anything. Log into your state's website, or you can even call them. Number 2, know what's happening in your state. The effects of these federal proposals wouldn't be the same everywhere. It all depends on your state's leaders and budget. So you need to check your governor's website or your state's health department for any statements on how they might respond to federal funding changing. Step 3, document everything. This is your defense against all mistakes. If work requirements ever become a reality, you'll need to prove that you're meeting the hours or that you're exempt. Start a file now. Keep every pay stub in one place. If you're looking for a job, document your search. If you're a caregiver, keep those records. Step 4, know your plan B. What happens if you do lose coverage? For many, the fallback option is the Affordable Care Act or the Marketplace. So get familiar with your state's Marketplace now, because losing Medicaid is a qualifying event and means you can get on there with a special enrollment period. Now, if you need help with any of this, or you would like to schedule a call to go over the specific Medicare plans in your area, I would be more than happy to help you. We've helped people in all 50 states, and we make sure you get the best plan possible and avoid all these mistakes. We'll create you a specific plan for your Medicare enrollment situation. We'll check all your doctors, your pharmacies, and your medications with all the plans in your area. So if that's something you'd be interested in, you can call the number on the screen or use the links down below. The first link in the description and the comment section is where you can get our free 2025 Medicare enrollment guide for absolutely no cost. And the second link is where you can book a one-on-one call with myself to go over your specific situation. So make sure and use those free links down below. Don't forget to like, comment, and subscribe. I appreciate you watching this video. Check out this other video where we go over the 2026 changes to Medicare prices. I'll see you over there.